Good morning. How are you all doing today? Hope today, Wednesday, is going well for you. Um, Hopefully, if somebody could let me know by just doing a quick chat if you can hear me just fine and if you can see the coronavirus and employee benefits on my screen that I'm sharing with you all.
Yes, we can.
Wonderful. Well, today's going to be just real quick, but I wanted to take advantage of the opportunity to share with our university community how the WSU benefit programs are, what they're providing, what they can offer to individuals that may be experiencing any issues with coronavirus. And that can range from what are our insurance plans doing for us, what are our retirement plans doing for us, as well as just making sure and pointing out the various leave provisions, if you haven't already heard about most of those, that the university is offering through either state benefits or through the federal benefits. So again, this should be real quick, but I think it's really good for you to be aware of these various provisions. So with that, we'll go ahead and start the presentation. And again, I realize not all of this is going to be applicable to everybody. For example, the assumption is kind of that you're on the employer benefits program package. If you're not, a lot of this may not be applicable to you. If you are on it, you may not be enrolled in some of these benefits. But if you are, you might be helpful or grateful to learn this information. So anybody that may have a flexible spending account or a health savings account, and those are two benefits that go with our medical plans. If you're in one of our low deductible plans, you may have a flexible spending account. If you are in one of our CDHP or high deductible plans, you do have an HSA account. And with the coronavirus and COVID-19 rolling out, some provisions were added to those benefits that were not previously there. They went into effect January 1, and so if you had any bills associated with these benefits, you can go back and make claims against them. At this point, there is no sunset as to when they're going to be turned off, so I don't have an end date of these benefit provisions. But the first one is prescription, over-the-counter prescription drugs that used to, over the last couple of years, if you were going to buy some allergy medicine or some sort of over-the-counter medication, in order to have both your FSA or your HSA cover that or be counted as an eligible benefit, you had to get a medical prescription from your doctor and submit that on to Navia or Health Equity, the two plan administrators, in order for it to be covered. That is not the case currently. Those are automatically going to be covered without a prescription. There is a limitation, however, in order to help us not enter into a mentality of hoarding these various medications. They will only reimburse for up to 3 identical products per transaction. So this may be something that could be helpful for you to make claims against your FSA or your HSA account. Also, they're covering menstrual cycle or care products that normally they don't cover, and they are opening it up that will be something that would be covered at this time as well. Our office is getting calls on some benefits like, can I make changes? For example, maybe you're having more medical expenses than you were anticipating during open enrollment when you made your FSA election. And people are asking, do I have the ability to change how much I'm going to be putting into my FSA for 2020? Under an FSA, there is a requirement for there to be a special open enrollment event. So a special open enrollment event usually constitutes I've gained coverage, I've lost eligibility coverage, or maybe I have a family member who's lost eligibility for coverage and I need to pick them up under my plan. I got married, I got divorced, I had a baby. So something kind of a big life event that impacts your overall household would trigger a special open enrollment event where you could go in and change how much you're putting into your flexible spending account. The health savings account, for those of you on the high deductible plans with an HSA, there is no triggering open enrollment or special open enrollment event to make changes there. You can make changes to your HSA contribution anytime you should want to. So that one is an open window. The one our office has received quite a few calls on, and again, this is a smaller percentage of our overall campus that participates in this program, but it's the Dependent Care Assistance Program. And this is a program that allows usually parents of children in daycare, but sometimes will be our employees that have an elder family member that they're seeking elder care on, or a disabled family member that they have some sort of daycare assistance that they are providing while they're at work. They can sign up for the Dependent Care Assistance Program, which allows them to set aside money on a tax-deferred basis and then utilize for those expenses. Of course, with all the daycares and schools being closed over the last couple of months, expenses are not coming in that had initially been anticipated when people enrolled in this program in January. So we've had employees asking, hey, can I make changes to my DCAP at this point? I believe, again, Navia, the plan provider, sent out emails to everybody as well saying, if you've had a change in your dependent care assistance premiums, your daycare expenses, you may want to go ahead and participate in a special open enrollment. And so what this will allow you to do is you could fill out a form saying, I'd like to stop my dependent care assistance participation right now due to the fact that my daycare is closed. We need some sort of document from your daycare saying that they're closed in order to show that there is the closure. Sometimes even websites, if some daycares have a website where they posted an announcement that the daycare is currently closed, we can just do a screenshot of that for the documentation purposes. And then that will stop the money coming out of your paycheck right now. And then once these various service plans start opening back up and services start opening up and allowing people to return, you could then trigger another special open enrollment event that now I have that cost associated with me and my family again, and I'd like to reactivate the benefit. There usually is a 60-day window from whenever something was closed for you to participate in a special open enrollment event. So if you happen to be an individual that's anticipated a closure of a daycare that maybe occurred in March, you might be really close to your 60-day window. So I'd encourage you to contact our office as soon as possible to have us assist you in making that adjustment to your account. Also wanted to point out just a couple of things that our medical insurance plans are offering during this time. Of course, if there's any medically necessary testing for the COVID-19 virus, all of those things will be covered at 100%. They've also allowed some flexibility with our prescriptions. If people have recurring prescriptions that they take, normally you have to wait until a certain period before your prescription will be allowed to be refilled again. They are allowing a one-time early refill on prescriptions. So if you're wanting to kind of stock up your supply and make sure it's on hand, so you, in the event something should happen that you can't get to the pharmacy right away, they are allowing a one-time early refill. Also, some of the prior authorization for testing and treatment of COVID-19 that some of our plans would require, especially the managed care plans, where a lot of times you have to get pre-authorization before you can see specialists or get treatment for certain conditions. They are suspending the prior authorization for any treatment and testing of the COVID-19. Another situation that they are being a little bit more lenient on is, let's say you need to see somebody for testing or treatment of COVID-19, but your local doctor is not addressing that condition, or they maybe are completely full. They're allowing some flexibility for you to see another provider without having to maybe wait for your provider to be available, or having to, with minimal travel, that maybe somebody that you would normally see you can't see, but you need to get into a doctor as soon as possible for testing or treatment. They're allowing some flexibility for you to see other providers that may not be part of your normal network. A couple of little pointers that you might not have thought about. Again, this kind of goes along with the first bullet or the second bullet about prescriptions. But if you have a chronic health condition and you normally just kind of are right up to the day of, I took my last prescription yesterday, but normally my prescription is refillable tomorrow or today, and that makes you a little anxious that maybe you'd like to have a stock up for emergency purposes, please investigate with your healthcare provider, your pharmacy, or even if your plan, if you can have some flexibility in that regard to have an emergency supply of your medications on supply at home. And then I know all of the plans have, over the last year or so, started rolling out telehealth or telemedicine options, that you can see a medical provider by a virtual environment versus seeing somebody in person. This may also be something that would be beneficial to you at this point if you don't feel comfortable going into a doctor's office for some of your other medical needs. You might want to check with them directly to see if this is something that could be addressed through the virtual telehealth option versus attending in person or going to the appointment in person. So those are the overall benefits that we have been informed of that are being adjusted for the COVID-19 virus. Some other things that come up at this point, of course, is a lot of people are maybe having to look into leave options if they have to take time off to care for themselves or a family member, or if they're in self-quarantine or something like that. And the question will often arise, what's going to happen to my insurance coverage if I'm out on leave? So I've just listed kind of a handful. Of course, this is not going to capture every scenario, but if you're taking leave maybe on a part-time basis, but still working part-time, your benefits are going to be just fine. If you're off on family medical leave and approved for family medical leave through our disability services unit, again, your benefits are always protected under family medical leave. If you happen to be on paid leave during the family medical leave period, we're just going to continue to capture premiums from the pay that comes through the system. If you end up being on a leave without pay situation while on FML, you may get a billing notice from the HRS benefits unit billing you for the premiums that we would normally be collecting from your paycheck. If you happen to be on shared leave, I know there's been some shared leave expansion to address various COVID issues. As long as you're on shared leave at least 8 hours a month, you're going to maintain your benefit eligibility. There's the Family First Coronavirus Response Act that also has been rolled out. It provides emergency paid sick leave or emergency family medical leave for the care of family members, etc. So there's some additional provisions under that particular program. If an individual is on that, there's a paid component automatically associated with it. And because somebody is in paid status, they will be maintaining their insurance eligibility. Another provision that's rolled out over the last couple of weeks is high-risk employees who are on leave. One of the provisions of that benefit is it does say that if an individual that's at high risk is on leave, even if it's on leave without pay, that their benefit should be maintained if at all possible. Sometimes there's been a discrepancy as to do they still need to be in paid status at least 8 hours a month or not. We will work with you to ensure that you're able to keep your benefits and try to work around any provisions of these various leaves to help keep your insurance coverage. It's of course, an unprecedented time that we're all going through. And people, in addition to wanting to make sure that they're bringing home a paycheck, also are very nervous about losing benefit eligibility at a time when they may need their benefits the most. So if you find yourself in any of these situations, again, usually you're going to start with the HRS Disability Services Unit on the leave aspect of it. And then if there's any benefit questions that arise, they will either refer you on to our unit, or you can contact us directly and we'll be happy to answer any benefit questions you may have. Also, it says got to, but how about if we go to the hrswsu.edu/contact, you can submit questions there on the leave or benefits, and somebody from the different units will get back in touch with you as to whatever leave questions you may have asked at that site. Money, so it's financial assistance. Some people are finding themselves maybe having a need for some funds. They may be not able to be teleworking or working from home. Their job may not lend itself to that. Their family may be in a situation where they, as a WSU employee, still have their job, but maybe their other family member or household member has been put out on leave without pay or even laid off from their job, and it's having an impact on their financial status within their household. The federal government passed the Coronavirus Aid, Relief, and Economic Security CARES Act, and under that, they allow individuals to take loans or withdrawals from retirement accounts up to $100,000 or the value of their account, whichever is more. The retirement accounts that are currently identified as being eligible for these loan or withdrawal options are the voluntary accounts offered through the university. So if somebody has a voluntary investment plan or VIP, sometimes people refer to it as an SRA with TIAA, or if they happen to have a deferred compensation plan with DRS, you're encouraged to contact either DRS or TIAA to discuss these options further, if that might be something that would be helpful to your family situation. Our regular plans, the plans that are matched by the university that we're all required to participate in, which include the WSURP, the PERS, TERS, LEOFF plans, are not available for these options. So it's only the voluntary plans that someone can participate in. However, if you happen to have another retirement account that you are not actively participating in, so let's say you may be an employee that throughout your career you started in PERS, and somewhere along the line you switched over to the WSU retirement plan due to something like a reclassification or something along those lines, and you just had left your money with PERS, you may be able to access those PERS funds because it's an inactive account right now. It's not something somebody is actively contributing to. That could be retirement accounts you have with other employers also may be eligible for these sort of transactions. A provision of our employee assistance program that individuals may not be aware is available as well is they do have financial counseling services available to individuals that have questions about, hey, my budget's got tight, how do I tighten up a budget, or how to even create a budget, or I'm really concerned about my financial situation. They will hook you up with a financial consultant that you can talk with. Usually the initial visit is free of charge under the Employee Assistance Program provision. Sometimes they will find through the course of that conversation an ongoing relationship needs to be developed, and there may be additional services that need to be offered that you will then take over as an individual, with an individual relationship with the person. But by all means, if you have any concerns, if you're losing sleep over what your financial situation is, take advantage of contacting EAP's financial consultant, and at least taking advantage of the initial free consultation and see if they can give you some pointers and help points on that regard. If you go to our website, HRS at WSU wsu.edu, you can find the contact information for all of the providers I've just listed above. So you can find that information on our website. And then some other resources, if you haven't already been taking advantage of them. I think what we're doing right now, the Daily Coup Connect, is one of the best things that is happening, is it's pointing out all sorts of things that can help in a lot of aspects that we're addressing. So I really encourage you to continue to participate in the Daily Coup Connect. I made reference to the EAP program already. Go to the HRS website and learn more about the COVID leave provisions and work informations that I referenced and outlined a bit today. If you want more details on that, there's a lot of great information on that website. Of course, the daily updates the WSU updates that we get through the WSU system as a whole is another great resource for you to be keeping in touch with and listening in on. For example, the town hall meetings they have on Fridays. Take advantage of those, go there. There's usually updates and information that's very helpful as to our status. And then the Smart Health Program, it's another great resource to provide tips and tricks on how to deal with stress, or how to maintain healthy eating styles, or working from home, or maintaining contact with your coworkers or loved ones if you happen to be at home and not interacting with people as much as possible. These are just some of the resources that are available that I'm pointed out here at WSU. And of course, there's other resources in our communities that would be of assistance there. If you have any questions about the things I brought up today, I'm more than glad to take them now if you'd like to, or you can contact us at the phone number, email address, or our website that is listed on the screen, and we will all be happy to have individual one-on-one conversations or answer any questions that may come up as you come across them. By all means, utilize us as a resource. We're here to help if at all possible. With that, that's my spiel for today, and hopefully it gives you some pointers and things you may not have been aware of. You may not need to be taking advantage of right now, but it might be good to know in the event that you needed to take advantage of them, these resources are available. I wish everybody a great day, and I think there may be another screen, or I can let you know tomorrow. What's tomorrow's topic? I think that they'll throw up a conversation about what tomorrow's session is, how being outside benefits your well-being. So by all means, join us again tomorrow at 10 o'clock and we'll have another session for you. Wish you all a good day. Thank you.